Welcome, everyone. Thanks for joining us today for the Coronavirus Q&A with Dr. Lindsay Carter, the medical director here at Devoted Health. My name is Kristen Hipp, and I'm on the Devoted Health marketing team. We're very fortunate to have Dr. Carter speaking with us today. Dr. Carter is the medical director here at Devoted Health. She received her MD from Harvard Medical School and her MBA from Harvard Business School. She's been practicing medicine for 8 years and also teaches at Harvard Medical School. For today's session, Dr. Carter will give a quick overview of what you need to know about coronavirus, then she'll take questions. You can feel free to start typing in your questions at any time. Before we begin, let's go over a few notes on how to best participate in today's event. Your microphone will be muted during this Q&A. When you want to ask a question, click on the chat button. It may be located at the top or bottom of your screen. A chat box will appear when you click on it. Type in your question and hit enter. While we hope to answer as many questions as possible, please provide your name and phone number with your questions so we can follow up with you if we don't get to your question during this time. For your privacy, please do not share any personal health information when you ask your questions. If you have specific health questions about your personal situation, please call our guides at 1-800-DEVOTED. That's 1-800-338-6833. If you think you're exhibiting symptoms of the coronavirus, we recommend calling your primary care doctor as soon as possible. Now I'm going to hand it off to Dr. Carter to get us started.
Thank you so much. Hi all, and thank you for joining us. My name is Lindsay Carter, and I'll be talking to you today about the coronavirus and then answering questions. The coronavirus and the disease it causes, COVID-19, represents an extraordinary new kind of challenge for all of us. And we at Devoted Health are committed to caring for you like family, and so we hope to do everything we can to get you through this challenging time. I'm going to start by talking just a little bit about COVID-19 or coronavirus more generally, why we worry about it, and how you can prevent transmission. And then we'll go ahead and open up for questions. And just a quick note before I start, I will be using the terms coronavirus and COVID-19 kind of interchangeably, and they'll mean the same thing for the purposes of our discussion today. So COVID-19 is the name of the disease caused by this newly recognized coronavirus. And coronaviruses are viruses that typically cause a mild upper respiratory illness like the common cold, and they've been around for a long time. The new coronavirus is causing a range of respiratory illnesses from a mild flu or cold-like symptoms, or even no symptoms, to more serious respiratory illness and in rare cases, death. The most common symptoms that people have with the virus include fever, cough, and shortness of breath. We worry about COVID-19 because it tends to cause more severe symptoms like a severe pneumonia or breathing problems in people who are older, so over 65, and especially those over 80, and in those with chronic medical problems like chronic lung disease, such as COPD or asthma, heart disease, and diabetes. So if this sounds like you, it's especially important to take extra precautions to prevent the spread of the virus and to prevent exposure to the virus. The best way to prevent illness is to avoid being exposed. The virus is thought to spread mainly from person to person through respiratory droplets that are produced after an infected person coughs or sneezes. And this happens when people are in close contact with each other within 6 feet. You can also get infected if you touch a surface that is infected, and then you touch your mouth, your nose, or your eyes. The best way to prevent being exposed is to stay at home and to limit contact with others. And by now, I'm sure you've all heard a lot about the idea of social distancing. This is really crucial and really is the only way that we're going to slow the spread of the virus. So it means that, unfortunately, you need to avoid any unnecessary contact with people outside of your immediate home. And yes, that does mean visits from other family members outside of your immediate home, which I know is really difficult. It means that you should go out only if absolutely necessary to get food or to go to necessary doctor's appointments. But we also want you to think about ways to minimize these things too. As much as you can, we want you to rely on delivery services or having your family drop things off for you. We also want you to speak to your providers about canceling or postponing things that aren't urgent. Many providers are already doing this. Many providers are also now doing telephone or video visits, and these are an excellent alternative right now. And we encourage everyone to call your provider to find out if they are offering these. It's also important, of course, to practice really good hygiene practices. So this means washing your hands often with soap and water for at least 20 seconds, and especially after you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water isn't readily available, you can also use a hand sanitizer, and you want to make sure that it contains at least 60% alcohol. Um, you want to, of course, also clean and disinfect surfaces in your home daily, especially those surfaces that are touched frequently by several people. So that's things like knobs or counters or tables. Um, Disinfecting, I'll just spend a second talking about. That means really doing something to the surface that kills the germs on the surface using a chemical. And that by killing the germs on the surface, it can further lower the risk of spreading the infection. The CDC website has an excellent link to lists of products that are good disinfectants for the coronavirus. And I encourage people to check that out if you have questions about the specific product you're using. For the most part, things like Lysol and Clorox-based products do a good job of disinfecting. But again, I encourage you to double check with your specific product, and that information is available on the CDC website. For disinfection, you can also make your own kind of homemade bleach solution as well. And I'll just say it briefly here in case it's helpful, but 4 teaspoons of bleach per 1 quart of water is thought to adequately disinfect. So that's another thing you might be able to use. I'm going to switch gears a little bit and just talk about sort of what to do if you feel sick. And then we'll go to the second part with opening up for questions. So if you feel sick, it's important to call your doctor first before going anywhere like an urgent care. Testing is still really unfortunately limited, so there's a good chance your doctor will want to talk to you on the phone and provide guidance that way, especially if your symptoms are mild. And that's really important to try to stay at home if you can to help prevent spread of the virus. If you feel sick, it's important that you stay at home until you're better. So that means 72 hours after your fever has gone away and at least 7 days since the symptoms started. So for many people, this means you would be quarantined or at home for about 2 weeks. It's also important to quarantine and stay at home and limit exposure to anyone else if you know you've been exposed to someone with the coronavirus. And the recommendation is to stay at home and quarantine for 14 days after you might have been exposed, because sometimes it takes that long for symptoms to show up. Again, if you have any questions about any of these things, what to do when you feel sick, we do encourage people to call their PCPs, their providers, but we too at Devoted are always here for you if you have any questions and are happy to answer them. If you call 1-800-DEVOTED, we can connect you with the right person to answer your questions. So before we go into the question and answer session, I just want to briefly recap how to ask the questions. So if you press the chat button, that will allow you to type in a question. Please include your name and phone number. Just in case we don't get to your question, we can follow up with you later. And then just another reminder, please don't submit any personal health details. If you have any questions about your personal situation, you can always call 1-800-DEVOTED, and we'd be happy to talk to you about that as well. So without further ado, I'll open it up to questions.
Thanks so much, Dr. Carter, for that great overview. Just as a reminder, like Dr. Carter said, please go ahead and type in your question in the chat bar, and please include your name and phone number. So in case we don't get to your question, we can follow up with you after this session. So first question, I'm getting some questions from from our members asking about if they normally have tests that they get done on a regular basis. Should they wait until after the virus has the fear is over, or that sort of thing?
Great question. In these cases, it is a good idea to talk to your provider about it, because the specifics of your case might change the answer to that question. So if it's something that you just get done on an annual basis and you're kind of due for your annual blood test, that's probably something that can be delayed for a little while. But if it's something that your provider is checking a little bit more frequently, so one example that a lot of people might have would be an INR if you're on a blood thinner, as an example. If they're checking that more frequently, they might want to continue checking it. Just again, if there have been any specific changes to your dosing that your provider still needs to keep an eye on. So, without going into too much specific, it's really important, I think, to check with your provider before you make a decision about postponing or continuing, and they'd be able to give you guidance based on your specific situation. For things that really are truly just routine and kind of on an annual basis, those things for the most part will probably be delayed. But there may be things that your provider feels are important to go ahead and do if you've had recent adjustments to your medications, for example. So do reach out to your provider for the specifics on that. But that was a great question.
Thanks. So we're getting a ton of other questions about the importance of wearing masks or protective gear when you leave the house. Can you speak to a little bit of that?
Great. Yeah, so this is a great question, and I know it's something on everybody's mind. Right now, the guidance from the Centers for Disease Control, which is the CDC, and a great place to go in general for lots of information on the coronavirus. Right now, the guidance from the CDC is that when you go outside, um, unless you are yourself having symptoms, that there isn't guidance that we should all be wearing masks. Um, and the reason for that is because the masks themselves, we don't think do a great job of preventing people from getting sick if you're otherwise feeling okay. What masks, and those are the regular kind of masks that would be available for you to purchase. The masks that do help prevent specifically from getting ill are masks that you may have heard of called N95 masks. And those are masks that are really limited for medical professionals who are taking care of patients who have the coronavirus. So the kind of the regular masks that you might be able to buy at the drugstore or online are not designed in a way that they really help prevent transmission of the virus if you're healthy and you don't have symptoms. What masks are helpful for is if someone is feeling sick, that sick person who has symptoms should wear a mask so that they don't spread the disease, the virus further, because the masks can help prevent the virus from being spread if you're ill. So again, masks themselves, if you want to wear them just to prevent the virus, right now the CDC's guidance, which is the most up to date and what we should be following, does not suggest that wearing masks to go out on a regular basis is recommended. But masks are suggested if you're sick, then that sick person should wear them to help prevent the spread of the virus. I know, you might see on the news a lot of people, especially in some other countries, wearing masks all over the place, and that certainly is something that we're seeing. But again, the CDC recommendation at this point is that we don't use masks for kind of routine prevention in people who are otherwise healthy.
Thanks so much. So, just as a reminder, folks, please, any questions are welcome. Feel free to add them in the chat panel. And as another reminder, please include your phone number and name with your question. So, one other question that we got was, are there any sort of at home remedies that can be used to either prevent or kill the virus?
Great. So I assume the question means, at-home remedies that you can take. It's a great question and one that comes up a lot. Unfortunately, there aren't a lot of remedies. And again, our experience with the coronavirus is so early still that we're continuously learning things. So viruses. And the one thing that actually has been proven to be effective in terms of preventing the coronavirus and other coronaviruses is over the counter zinc remedies. And those are products like Coldies or Zicam, you may have heard of, available over the counter. And they're marketed to help shorten the duration of the common cold, which are often caused by other coronaviruses. So while those zinc lozenges have not been studied specifically yet for this new coronavirus, there's some suggestion or hope that maybe taking the zinc lozenges could be helpful in preventing. They are helpful both in prevention as well as if you start to feel any symptoms at all, it might help lessen the duration. Again, that's evidence we have more for the general coronaviruses, and it has not been studied specifically in the new coronavirus, but it's a safe over the counter product that we think is useful for people to try. In terms of other home remedies, that's really the extent of what we'd recommend at this time. We don't recommend doing a whole lot of, special remedies or herbal supplements for this yet. Those themselves, without being tested, potentially could have some danger associated. So I think I'd stay away from real home remedies other than maybe trying the zinc lozenges, which has some promise.
Thank you, Dr. Carter. I've gotten another question about home deliveries of supplies and if it's safe to get those things delivered to your home, such as grocery, takeout, that sort of thing.
Great. And obviously, especially important as we're telling you to stay at home and not go out. So the alternative, of course, is to have them delivered. So is that safe? So the I'll answer that in two ways. One, for delivery, you want to make sure, of course, you might be worried about the people doing the delivery having, being infected or exposed to the virus and passing along that way. So as best you can, if you do have things that are delivered, I try to avoid actually direct contact with the delivery person if you can. So that's one way to minimize contact. Then the question is, and there's been a lot of coverage in the media around how long the virus might survive on various surfaces. So the concern would be if you have something delivered, how do you know that you're not just bringing it in to your home via the surfaces that come in with your delivery? And that's something that a lot of people are worried about. So I'll talk a little bit about that. And actually just the question of the virus living on surfaces. So again, we don't have a lot of evidence yet, but there have been a few studies looking at different surfaces and how long things can last on it. And we think that the virus can last up to 72 hours on plastic or stainless steel. Things like copper or cardboard, a little bit, that doesn't live as long on those things. So cardboard, it looks like it's more like 24 hours. So that's important because if you get something delivered, of course, you can't wait 24 to 72 hours to bring it in. So what I'd encourage people to do just to be really safe is to make sure that you wash your hands immediately after handling the delivery. Your deliveries are likely going to be in bags or in cardboard boxes. So I would put the outside layer of the delivery immediately into the trash, and then make sure you practice really good hand hygiene on yourself, and then wipe down any other surfaces that might have come in contact. And that's really sort of the safest way. We think deliveries in general really are a good way for you to minimize contact with the virus by going out into the world. And so we do think it's safe, and we just want you to take a little extra precaution when accepting those deliveries, trying to avoid contact with delivery people if possible, and then just being extra cautious about the surfaces like the bags and the cardboard boxes. But we do think they're safe, just with precautions.
Thank you. So we just received one question about whether or not a flu shot can help prevent coronavirus.
Great. And that's actually a good question to talk a little bit more broadly about vaccines in general. The flu shot and pneumonia shots, things like that, they do not prevent the coronavirus, unfortunately. There's a lot of research going on right now to try to develop a vaccine, excuse me, specifically for the coronavirus. And so the quick and short answer to the question is no, it does not prevent the coronavirus. However, getting your flu shot and making sure you're up to date on your pneumonia shots are really important so that you don't get hit with multiple infections that could make you really sick. And so we encourage everyone to make sure that they've gotten their annual flu shot and to make sure they're up to date with their pneumonia vaccines as well, because that may help prevent you from basically getting two illnesses, which would make you could make you a lot sicker. The pneumonia vaccine, if you're not familiar, there are two different pneumonia vaccines. One is called the Prevnar vaccine, and the other one is called Pneumovax. Typically, depending on your own personal health situation, most people just need those one time in their lifetime. You may have gotten it a little bit earlier and then need a booster, again, depending on your personal health situation. So if you're not sure if you're up to date on your pneumonia vaccine, I would be sure to reach out to your provider directly.
Thanks so much. Now, I know you touched upon this a little bit during your introduction, but people are wondering if they can have family come visit them or if they can go visit their family.
Yeah. This is such a hard question, and the short answer is that it's really safest to minimize your contact with just the people who are in your immediate household, and that's so hard and so hard for so many people now, just feeling feeling isolated in the home, and I understand that, and that's really difficult. But the safest thing to sort of fully practice social distancing is to limit your contact with people directly in your home. As soon as you start to open up your home for anyone else, you unfortunately introduce, of course, the people who you open up your home to, but then anyone who they might have come in contact with, and it just increases your risk a lot just by having a few extra people in your house. This is temporary. So I want to say that this is temporary. We don't know how long it will be, but at least for the next several weeks and probably the next month, it's really the safest thing to do, to limit contact to just your immediate household. And I recognize how hard that is, especially for people who want to see their children and grandchildren. It's so hard, but the safest thing to do is to really strictly be practice social distancing now so that we can all sort of have a healthy and happy future to look forward to.
Thank you. Just as a reminder, everyone, please, we're open to all questions. Please feel free to add them in the chat panel. So one other question we received is it safe or encouraged to go outside at this time?
I'm glad you asked, and absolutely. I think that's one of the really important things is to make sure that people are still getting outside, getting their exercise. There is nothing wrong with going outside, and we actually just strongly encourage everyone to do so. We're fortunate that the weather, springtime weather is turning nice as well, and so take advantage of that. We have been closed down because even though those are outside, those surfaces potentially are higher risk. So for playgrounds, things like that, you want to avoid. But for going for a walk, anything like that, that is absolutely recommended. And you just want to make sure that you maintain a safe distance from other people that you see outside. And so the distance that's being recommended is 6 feet. because we don't think the coronavirus can travel that far. And so as long as you are keeping a safe distance from other people when you're outside, it is strongly encouraged that you do so, and really good for your health to get outside and get some exercise.
Great. So we just got a question about if we have any suggestions for how to handle or wash produce.
Great. Um, so that's a great question. I think that the safest thing to do, likely with the produce, is to wash it off when you get it into the house. There is a chance, of course, that it's been handled by others in the grocery store, and so I would recommend washing it off with soap and water, much like you would wash your own hands. Would wash it off with soap and water. And you can use kind of the soap that you would use on your hands, but of course you don't want to use kind of, any dangerous chemicals in washing the produce, but the soap and water that you use for your own hands would be safe for the produce as well.
And along sort of a similar vein, does heat or high temperature kill this virus?
Great question. I think that's something that I think there is research going on to determine sort of how the exact temperature is needed to kill the virus. I think that evidence and that research is still ongoing, so I don't have a specific guidance on the actual temperature there. I can be sure to look into that. I think, like I said, this information and evidence is changing on a daily basis. I see that's a question we've had a few times come in. So let me look into that, and I can disseminate the information. We can update our website as well if there's useful information that we find on the evidence there.
Great. So kind of going back to at-home remedies. So we received one question that they heard that there's a toothpaste that can kill coronavirus. Is that true?
Yeah, I've heard that question before, and as of right now, there are no products like toothpaste that are proven to kill the coronavirus. Again, things are changing so rapidly, and so we at Devoted are keeping an eye out for the latest scientific breakthroughs and the evidence, and we'll be sure to update our website as we get that information. Right now, there's nothing specific in terms of any specific products that you can buy that would kill the coronavirus. Similarly, in the same vein, unfortunately, as many of you know, right now there are not specific treatments either, though again, that's something that's being studied as we speak.
Great. So this question is probably on top of everyone's mind. But what should you do if you have symptoms?
Great. So great question. I'll talk a little bit just about what the symptoms are again, and then what to do. So the most common symptoms that we're seeing with the coronavirus are fever, cough, and shortness of breath. Symptoms can also include things like general congestion, sore throat. Very rarely people are having gastrointestinal symptoms like diarrhea, though that's much more rare. 90+% of people do have a fever with the coronavirus. So that really is a telltale symptom. So if you start to have symptoms like that, the first thing we always recommend is for you to get in touch with your own PCP, your own provider. They know your own specific health conditions, of course, the best, and can give you guidance, kind of talk through your symptoms with you. But we at Devoted are also here to talk to you about that. So if you can't get in touch with your provider, or if you have any further questions after you talk to your provider, we are, of course, happy to talk to you. And if you call 1-800-DEVOTED, you'll be connected to one of our nurses who can talk to you further about that. So if you have symptoms, of course, the first thing to do is to make sure that you are getting in touch with your provider. Most of the time, 80% of cases that we've seen of the coronavirus are on the milder side, and people do well just staying at home, and they don't need any specific hospital treatments or anything like that. So if you do feel sick, again, always first call your provider, but there's a good chance that they will tell you to stay at home and to monitor your symptoms. And if that's the case, of course, you want to make sure that you're not having any new severe symptoms. And I'll talk a little bit about what that might be in a second. Um, but as long as your symptoms remain mild, really staying at home and taking just over-the-counter medicines that you might take regularly for something like a cold or a flu are recommended to help treat your symptoms. The one thing that is emerging is that Tylenol is probably the best medicine to take, assuming it's safe for you specifically. Tylenol is the best to take to lower your fever, or to take if you have any other general aches and pains associated with the coronavirus. So instead of taking something like ibuprofen or Advil, it's much better for you to take Tylenol. And then other kind of cold and flu medicines, like I said, that you might take to manage your symptoms are safe for you to. Again, we always recommend calling your doctor first, but in the event of an emergency, of course, you always will need to go to the emergency room. But the things that we'd worry more about would be if you start feeling really short of breath, if you start getting confused, if you're unable to eat or drink, keep things down, or if you're feeling lightheaded, because that might suggest that you're quite ill as well. So those would be things to kind of keep an eye out for, and those would be reasons why you'd want to call your doctor right away if you start experiencing any of those things.
Thanks so much. And also, folks, I apologize for any of the audio issues that you might be experiencing. Everyone here at Devoted Health is doing our part by staying home, so we're having some technical difficulties at times. So sorry about that. So we just have another question about safe food handling.
Mhm.
I know you talked about soap and water for fruit and vegetables, but we had a question about whether or not vinegar would be a good solution for cleaning.
Mhm. And I'll say too, I know, my on my part, my internet connection might be a problem as well. So if there's ever a chunk that you haven't heard well, I'm happy to repeat it as well. Um, and again, just apologies for that. We're all like Kristen said, doing our best to stay home and practice social distancing ourselves. Um, Vinegar for washing fruits and vegetables. So white vinegar is actually a good solution it is used as sort of a safe organic solution to clean things. It's often used as a natural cleaning solution in the home. So I do think that would be okay to wash fruits and vegetables. Just make sure, of course, to rinse in plenty of water and get off any residual vinegar. But washing with a vinegar-based solution and then rinsing with plenty of water would be okay.
Okay, so we received one pretty specific question. Is it true that if you can hold your breath for 22 seconds, it means that you don't have the virus?
That is very specific. I have not heard anything specifically on the 22 seconds, but I think I can answer that in another way, kind of more broadly, which is what it's getting at is if you're able to hold your breath for a period of time, then that likely means that what I think that tells you is that you don't have any problems with getting oxygen into your lungs and into your blood. The coronavirus, one of the symptoms in more severe cases is that it inhibits or makes it difficult for your body to basically deal with oxygen, which of course you need. And so if you had a more severe case and your body was having trouble handling oxygen, then you wouldn't be able to hold your breath for that long because you needed the oxygen. Um, so but that said, the coronavirus comes in all shapes and sizes. And while some of those more severe breathing symptoms could certainly be one of the ways that coronavirus manifests itself, you can also have much more mild cases that don't impact your ability to breathe at all. So while being able to hold your breath is of course a good sign and means that your oxygen levels are good, that doesn't exclude the possibility that you have a more mild case that's just not affecting your lungs. So I hope that answers the question.
Thanks so much. Let's see. So I guess one other question is if, we're all doing our part by social distancing, and we're not really leaving the house, do we need to be as diligent about cleaning around our house
Mhm.
since we're not having as much interaction with the outside world?
Yeah. So great question. The I think everyone should continue with good hygiene practices and making sure that the home is clean. If you're truly not going outside at all and no one is coming in and interacting in your home, then the risk of the virus being introduced in those couple days is of course extraordinarily low. And you likely, while you should still for sure make sure that you're practicing good hygiene and cleaning things off, you may not need to be quite as strict about it as someone who is going outside the home to get groceries or has someone coming in and out of their home. Again, the safest thing to do is to maintain those really good hygiene practices, especially when anything kind of enters the home from the outside. But again, if nothing is coming in and out and you've been in the home the whole time, you probably can be a little less strict about it. One thing to note, however, is that if there's anyone else in the home with you, there's always the risk that someone may actually have the virus and not show symptoms. It's rare to not show any symptoms, but we do know that people can have the virus and they don't show symptoms for the first few days. So I say that because you may feel, again, if you're at home and no one's coming in and out, you may feel pretty good that the virus hasn't come in. But there's always the possibility that somebody in the home has no symptoms, but does indeed have the virus and could be spreading it. So if there's anybody else in the home with you, I still would encourage you to maintain those really good hygiene practices just to be on the safe side.
Great. Thank you so much. So one question that we've received is, how do I get my prescriptions if I can't leave the house?
Great question, and we do have a good answer for that. So there are a couple different ways, and in case any of the details you forget, we actually have information about this on our website. So if you go to devoted.com, there's a banner across the top that has the coronavirus information. If you click on that, it takes us to it'll take you to a page that has a lot of information about the coronavirus and about ways you can stay safe. And there's actually some information there about how to get your medications. So again, just in case if you forget any of these details, all that information is there for you on the website. And any of our guides on the phone, if you call in, we'll be happy to help you with this as well. Um, so there are a couple different things you can think about. One is that CVS Caremark, which is the mail order, will deliver medications to you for a 90-day supply at a time. And if you don't already have mail order set up, we encourage you to call in to 1-800-DEVOTED and we can help you with that right away. It does, you do need a prescription from your doctor to make sure that it goes there, but we can help set that up for you. So mail order delivery is one way to do that. The other thing is that a lot of pharmacies are now doing local delivery. So I encourage you to call your own pharmacy. If you're not interested in mail order, I encourage you to call your own pharmacy because there's a good chance that actually they're thinking about doing just local delivery for you and may be able to set that up. I do know that many pharmacies like Walgreens and CVS are already doing that. And again, there's more information on our website about some more specifics. But either mail order or home delivery just from your local pharmacy are two great options to get your medications without going out to the pharmacy.
Thanks so much. So I think we only have about one more question. So if anybody has any lingering questions, please chime in when you have a second, and please include your name and phone number if we aren't able to get to your your question, and we'll follow up with you after this presentation. So that question is, do you have any suggestions for ways to fight the feeling of isolation? Are there outside uh, sources that I can find activities to do, that sort of thing?
Yeah, and that's such an important question, and I think one way to think about this is a time of social distancing, but should not be a time of social isolation. And it's so important to try to combat that feeling of isolation that we're all naturally feeling during this time. Fortunately, now during this time, we live in an age of technology, and many people have access to the internet, to computers, maybe to smartphones as well. And there are a lot of different things online now that are basically helping to kind of promote community. So we have a few examples again on our website, but there are things like virtual opera that are being offered. I know that several zoos, for example, are doing like virtual tours of the zoo. And there are tons of museums that are doing virtual tours of museums. So I encourage you to look if you do have access to the internet, to look around on there, because there are lots and lots of different sites and museums and other services that are now offering kind of online tours and things, just to help people, feel connected and have something to do. There's also, we encourage you now to use other tools to stay in touch with each other. And so, of course, with family, talking on the phone. FaceTime, if you have that ability to do FaceTime, is a wonderful way so you can still see people and talk. Um, Local churches and things like that may also be doing online services or other sort of virtual get-togethers. And so, if faith is important to you, and you belong to a church, that may be something that you could pursue as well. Communities all over the place are just looking at ways to do that, and to help keep people socially distanced but not socially isolated, because that's so important during this time. Um, and we at Devoted are also in the process of putting together resources like this so that we can help you. And it's something we're working really hard on, and we hope to have very soon.
Thanks so much. So I think that was probably the last question. There were a couple questions that came through that were pretty specific to the person. So we'll reach out to you after this to address your specific needs. So I just want to say thank you so much, Dr. Carter, and thank you to everyone who joined and asked such great questions. Like I said, if we didn't get to your question today, please make sure that you enter your question along with your name and phone number, and one of our guides will follow up with you. As always, you can also give us a call at 1-800-DEVOTED if you have additional questions. That's 1-800-DEVOTED, which is 1-800-338-6833. Thanks again for joining us, and please stay safe.